For this evaluation, we wanted to hear lots of different perspectives and hear from lots of different people about what was working or wasn't working so well, and how well the action plan had been implemented over the previous 5 years. So we collected information or data from in a variety of different ways. Firstly, we did some online interviews, and they were completed by 151 people, adults with spinal cord injury, plus their family, our whānau members. We had carers complete it. We also had healthcare professionals, both working in the acute spinal units, but also working in Starship Wilson Centre and in the community, so in a variety of different places. We also completed 17 interviews with adults with spinal cord injury or children and adolescents with spinal cord injury. And the children and adolescents had carers, family members join them, so we chatted with them as part of that. That was to get a deeper understanding of different people's stories and how they were experiencing services. Finally, we approached a variety of organisations to ask for some data, some numbers data really, that helped us understand who was using services and how long things were taking. So we got data from funders like ACC and Ministry of Health, from services like Spinal Unit, and particularly that was around outreach services and follow-up assessments and things. And also we got a lot of data from the New Zealand Spinal Cord Injury Registry. So that's how we got all our data, that's where we collected it, gathered it all together, and from that we've come up with the findings. The full report can be found on the BAIL website, and you can read some more detail there. Don't hesitate to get in contact though if you've got any further questions or want more information. Thank you. There was a variety of things that happened, positive things that happened as a result of the spinal cord action plan, and we highlighted those in our report. But just to summarise, there was 4 key areas that we felt there'd been significant progress in. One was around collective action. The positive outcomes that had come out of the action plan really demonstrate the value of having some forum for guiding collective action and establishing clear goals and for facilitating these collaborations. And so that's why we were recommending that there's an ongoing forum of some kind to help with this ongoing communication, and therefore with the positive outcomes for people with spinal cord injury. Second thing was the actual document itself. The Spinal Cord Action Plan document was a very good guiding framework and provided an explicit guide to action really. It had been determined by a group of people who would prioritise what they thought was important. And so it was a really great way of services being able to work out what they should work on first, researchers being able to get funding for things that they felt needed to be improved. And so the document itself was really helpful. There was a number of work programs that were successfully implemented over the course of the action plan implementation period, 2014 to 2019. There was a destination policy, which was about getting people into specialist units more quickly and getting them to surgery more quickly. There was a specialist paediatric and adolescent rehabilitation service called SPARS, and that was making sure that children and adolescents with spinal cord injury could get rehab in an age-appropriate service. There was the implementation of the New Zealand Spinal Cord Injury Registry, which is a routine collection of data across New Zealand, which is really helpful in terms of improving services and also making sure that people's needs are getting met in an ongoing way. And then there was the Attendant Care Pilot Program, which was a pilot which was looked at whether people could bring their own, well, the feasibility of people bringing their own carers into non-spinal specialist wards, and whether those personal carers could then provide the spinal cord needs in a way that was more effective and more personalised for the person with spinal cord injury. So that was piloted as well. The fourth sort of overall thing that we talked about is this positive engagement, that over this period, as a result of the action plan, there seemed to be quite some really nice positive engagement between funders and providers and different service different services, etc., working together to come up with some solutions that were more likely to meet individual people's needs. And we saw that also with the peer support services, where we've got New Zealand Spinal Trust and Spinal Support New Zealand working to develop a New Zealand consistent peer support service that is the same between services. So there was this positive engagement that happened. So all of these things were great, and we were really happy to report how well the action plan had supported them. As you would expect, there were a number of suggestions for improvements made within each of the objectives. This particular video is just highlighting our overall recommendations about next steps, and each of the different objective videos will also highlight what was recommended within each of those sections. So this is an overall. Essentially, there was 3 key sort of strategic directions that we were recommending. First was about ensuring that there was equitable access to services. And this was partly about who the funders were for different individuals with spinal cord injury, but it also was about whether people had multiple other health conditions that they were having to manage, or whether they had a non-traumatic spinal cord injury and therefore didn't quite fit the pathways, or whether they had issues with literacy or had difficulties advocating for themselves. All of these things we felt could be worked on to ensure that there was equity of access and therefore equity of outcome for a wider range of people with spinal cord injury. As part of this, we thought it was really important to include a wide range of people in the design of services, so that services were reflective of the diverse needs of the population that they were designed for. So we called that participatory service design. And essentially, we were really interested in encouraging more people with spinal cord injury and their families, and potentially their carers as well, plus also community-based therapists into the design of services. And a segue to that was the third thing, which was about innovative service delivery, particularly for outreach and reassessment services. And there's a need to really look at what do people really want, what best meets their needs, and how can we meet that? And how can we be more responsive in the way we're meeting it? So we heard quite a lot from people that they were keen for this opportunity to just ring up and say, am I on the right track? Should I be worried about this? Is this something I should follow up with? Where could I access this support? And this kind of to and fro support seemed to be what people were wanting, as much as an overall all-in reassessment. There was a few key work programs that we felt needed to be worked on sort of as a higher priority. And I've highlighted some of these already, but just to make them specific, first was about flexible pathways. Clinical care pathways work really well when you're in the middle of the road, but when you've got multiple needs, or you come with a non-traumatic spinal cord injury, or you've got other issues in your life, then often pathways aren't really responsive to your needs. So we feel that there's a need for flexible pathways. Pain management is an ongoing issue and needs to be addressed. Housing modification processes, they're quite slow for many people, particularly around temporary accommodation, and then the process for the housing modifications are often quite complicated and convoluted, and so some increased transparency so people can see where things are up to, where the roadblocks might be, and how they can help advocate for those roadblocks to be worked through. In terms of younger people with spinal cord injury, working out and implementing processes to help them transition to adult services is something that we would think needs to be worked on. And finally, peer support, having it available for a broader range of people. So not everybody is having their peer support needs met currently. Children and families are not able to access peer support. Families of adults with spinal cord injury are also saying that they often don't get the support that they need and would like. And thirdly, people with incomplete injuries, and particularly people who are walking with a spinal cord injuries, often reported that they would like more access to peer support. So those are some of the areas that we were recommending more generally.